Hi there, I'm going to be performing a sterile dry dressing change today. So before I do anything, I'm going to check the doctor's orders and make sure that's what was actually indicated. I'm going to gather any supplies that I think I might need, such as clean gloves, sterile gloves, grab saline receptacle. I have a marker with me, and also I grabbed the dressing tray that was provided to us in our lab bag. So I'm going to go to the patient's room, introduce myself. Hi, my name's Shannon. I'm a student with Eastern Florida State Nursing Program. Is it okay if I inspect your wound and change your bandage today? Yes. So I'm going to ask the patient their name, date of birth. It's Mickey Mouse. I don't know when he was born, but check 2 patient identifiers. Make sure they are who they say they are. Awesome. Let's proceed. So I'm going to provide some privacy. Ask the patient, are they in pain? Do you need to use the restroom? Is there anything that's making you incredibly comfortable right now? No? Okay. So hand hygiene. I'm going to put on my clean gloves. And then ask the patient if they have any allergies. That's always good, necessary. Before you do anything, always ask permission. Is it okay if I look? Yes. All right. You always want to let the patient know what you're doing before you do it so you don't startle them. I'm going to pull down your shorts down a little bit and lift your shirt up just to inspect. So while I'm here, I'm going to look. Is there any obvious drainage, redness, swelling? I'm going to loosen the edges of the bandage up, making sure to hold the skin taut and pull the opposite way. If the edges were super hard to pull off, I would use a little saline to loosen it up. I'm going to pull the bandage away so the patient doesn't have to see their funky bandage. I'm going to look at the color of the drainage that is on here. Is there a presence of any odor coming out? I have a trash receptacle right here, by the way. So I'm going to throw that right here. If the patient has sutures or staples, I would count the staples. I would check for any granulation. Is the wound healing? Is it draining, funky odor, color? Go ahead and measure the wound. All right. I think I have a good idea. So while the patient's exposed like this, please do not touch it. Try not to move. Do not contaminate your wound in any way. Awesome. So I'm going to get rid of these gloves, perform more hand hygiene, and I'm going to get all my equipment set up. So I noticed our lab bag gave us a sterile field. I'm going to use that. So I opened it. I know I can grab the outer corners of this. I'm going to pull it all the way out. And ta-da! Whatever is in here, I know this is not sterile, so I'm just going to kind of dump it, making sure to stay within my borders. Now I am going to, I made this my sterile saline. I'm going to unwrap it, making sure not to touch it so I can put it in my sterile field. This is my saline. It is unopened saline. If it was opened, I would check and see if there's a date on it, because I know they can only be, you can only use them for 24 hours. So hopefully it's a brand new bottle. I don't have to worry about that. I'm gonna pour the saline in. Awesome. Now I'm gonna put my sterile gloves on. I'm gonna pull them out, only touch the inside of your dominant hand. Pull it on. Non-dominant hand, and even if your dominant hand is not perfect, that's okay, because once you get this glove on, you can fix them. Awesome. All right, so I feel like I'm ready. First, I need to clean the wound, so I'm going to take my sponge and I'm going to dunk it in the saline, and I'm going to get rid of any of the excess because we don't want too much. I was also provided with some forceps. Once I touch the body, my hands will be contaminated. So I'm going to use a forceps to clean. Only one area at a time. Toss it in my receptacle. I'm going to do the same thing with one more. put it in the saline, rinse it out, and awesome. So now I feel like I'm ready to cover it. I'm gonna cover that. I'm gonna use one more. And looks good. So I'm done with these gloves. I'm gonna use them anyways, put the abdomen bandage on it. So I'm gonna lay the abdomen bandage over. Obviously you wanna make sure you pick a bandage that's appropriate for your patient's size. This one's a little bit too big. It's what I have to work with, so that's okay. I'm gonna get rid of my gloves, fold them inside out, place them in my trash bin, and now I am going to take the edges. Well, take the edges down. I'm going to take down all four corners. Emphasis on appropriate size bandage. Awesome. So now I'm going to initial and put today's date on it so everybody knows I changed it. It's been done. I'm going to clean up my work area, throw everything away that I don't need. And I'm going to, well, tuck the patient back in, making sure they're comfortable. And ask them if there's anything else I can get them. Go ahead, give them their call light, make sure their bedside table with all of their personal belongings are within reach. Ask them if they have any questions. Nope. Okay, now I'm gonna go perform a hand hygiene, document everything I did, and wish him the best.